it's Tim and Brandon. This week's blog is on myofascial pain syndrome and trigger points. So we asked an expert in this area, Tom Hyde, to give us his top 5 trigger points that are often unrecognized. Tom's list started with number 1. That was?
Subcapularis is probably my favorite unrecognized trigger point area because it's the rotator cuff, and this is a reason a lot of times people come in to see us. And the reason we overlook it is because it's hard to get to. And one of the things the subscapularis does that we often don't think about is to depress the humeral head, and it has a great mechanical advantage to do that. So when we find structural deviations in that, we're looking for tears, but MRIs really aren't that good. 56% sensitivity, 77% specificity for diagnosing a tear, and really our orthopedic tests aren't much better. In fact, the liftoff test has to have that subscapularis torn 75% before you can find with that orthopedic test. And from a prior blog, I think we used the bear hug test and the belly press test to have the best sensitivity and specificity to make this diagnosis. So this is one of those things that when you start to develop a trigger point in this area, it can really affect a lot of different things and often unrecognizable. Check out our video on ChiroUp and how to address this using manual therapy.
So you saw that video, and that's something that patients don't like. Another muscle that they may not like is the scalenes, one of the muscles that was on Tom's list, especially the anterior and middle scalene. So these trigger points develop usually in the mid to lower portion of the muscle, and they can refer pain out to the arm. Sometimes they'll even refer to the intrascapular area, but what they're really responsible for is tightening the muscle and creating a thoracic outlet syndrome. So numbness and tingling all the way down into the palm, most often into the 5th digit. In fact, 90% of TOS symptoms occur in the 5th digit, or the distribution of the ulnar nerve. So that you can see on this video, stripping those scalene muscles a little careful because we've got to watch the neurovascular bundle that lives in between those two, but something that pays big dividends when we can relax that muscle and teach that patient how to keep those trigger points away.
One little known clinical pearl is if you hold that trigger point really tight with both hands, you'll eliminate all that person's pain. So the third one is the pectoralis, and this muscle is very important, especially in high school and college, to impress females if you're a male. But really the function of this is more your adduction and flexion of the humerus. I see this a lot in athletics. However, lesser known are after any kind of thoracic spine surgery, and also our postural people. We always think about trigger points as far as a repetitive stress to cause a pain, but we forget about the postural loads that we place on our spine. And with today's society, having this posture, we can see a lot of trigger points develop in those muscles that are in that constant state of contraction. Therapies that I use over and above manual therapy are exercise. Just get it moving. Take the person from here and turn them into this position. I like to use the YTWL exercise for that in Brugger relief position. And also dry needling has shown very good promising research on the effectiveness of dry needling for trigger points.
And unfortunately, your trigger point has caused trigger points in my trigger point, and that's that tight pectoral muscle, and those trigger points that pulled the head and shoulders forward have created a stress of the serratus anterior, and that's another muscle on the list. That this serratus anterior, a lot of times we'll get a stitch in the ribs, usually mid-axillary line about the inferior border of the scapula. Patient gets it when they're running, when they're coughing, and there's discomfort. So we can get to that muscle, we can work it. We don't have a video for that one for you, but what we have is something more important, and that's address the cause of that tightness in the first place, which is usually scapular dyskinesis. Weakness in the serratus anterior and weakness in the lower traps, along with tightness in the upper traps and tightness in those pectoral muscles, pulls things forward, puts a chronic stretch on that muscle, and no muscle likes that chronic stretch. So we can work the trigger point, but more than anything, we're going to teach them those YTWL exercises. We're going to teach them how to recruit their scapular stabilizers and get that shoulder back into a better position.
Now for the fun part is we're going to show on Dr. Bertelsmann pelvic floor trigger points.
Well, I thought it was you. I brought this along. But
no, the pelvic floor trigger points is actually kind of an exciting topic. That is our next protocol. So we've already done the research on it. It's going into our advisory board's hands, I would say in the next month when it gets completed. Very excited for this protocol. We've had a lot of outside help from the experts in the field, so look out for that one.
Thanks for watching.